Let's talk about something most people avoid, but everyone needs to understand. Sexually transmitted infections, or STAs, affect millions of people in the United States every single year. And here's the surprising part. Many people who have an STI don't even know it. No symptoms, no warning signs, no clue. Today, we're breaking down what STs really are, how they spread, what symptoms to look for, how they're treated, and most importantly, how you can protect yourself without shame or fear. If you're sexually active, this video is for you. Sexually transmitted infections, commonly known as STIs, are one of the most widespread and misunderstood health issues in modern society. Millions of people across the United States are affected every year, yet many remain unaware of their status. The reason is simple but alarming. Many STs cause few symptoms or none at all. Despite medical advancements, access to testing, and effective treatments, stigma and misinformation continue to surround sexual health. These barriers often prevent people from seeking care early, which can lead to serious long-term health consequences. This video is not about fear, it is not about blame, and it is not about judgment. It's about facts, awareness, and empowerment. In this video, we will explore what sexually transmitted infections are, how they spread, the symptoms they may cause, how they are diagnosed and treated, and what steps can be taken to prevent them. Most importantly, we will address why open conversations and regular testing are vital for individual and public health. If you are sexually active or ever plan to be, this information matters to you. Section 1. What are sexually transmitted infections? A sexually transmitted infection is an infection that is primarily spread through sexual contact. This includes vaginal sex, anal sex, oral sex, and in some cases, close skin-to-skin contact involving the genital area. The terms STI and STD, which stands for sexually transmitted disease, are often used interchangeably. However, medical professionals increasingly prefer the term STI. This is because a person can be infected without showing any signs of disease. In other words, an infection may be present in the body without causing noticeable symptoms, yet still be transmitted to others. This distinction is important. Many people assume that if they feel healthy, they must be free of infection. Unfortunately, this assumption is often incorrect. STIs are caused by different types of organisms, including bacteria, viruses, and parasites. Each type behaves differently in the body, which affects how it is treated and managed. Section 2. How common are STIs in the United States? Sexually transmitted infections are extremely common in the United States. According to public health data, millions of new infections occur every year. Some of the most common STIs include chlamydia, gonorrhea, syphilis, human papillomavirus, or HPV herpes simplex virus, human immunodeficiency virus, or HIV trichomoniasis. Young adults and teenagers experience higher rates of certain STIs, but infections occur in all age groups. In recent years, STI rates have also increased among adults over the age of 50, partly due to lower condom use and the assumption that STIs are only a concern for younger people. Relationship status does not eliminate risk. People in long-term relationships can still be exposed if one partner was infected previously or if trust replaces testing. STIs do not discriminate. They affect people of all genders, sexual orientations, ethnicities, and socioeconomic backgrounds. Section 3. How STIs are transmitted. Sexually transmitted infections are spread through the exchange of bodily fluids such as semen, vaginal fluids, blood, and through direct contact with infected skin or mucous membranes. It is a common misconception that penetration is required for transmission. In reality, many STIs can be spread through oral sex or simple skin-to-skin contact. Some infections, such as herpes and HPV, can be transmitted even when condoms are used, because they may affect areas not fully covered by protection. Another critical factor is asymptomatic transmission. Many people carry STIs without knowing it. During this time, they may unknowingly pass the infection to others. STIs can also be transmitted through shared needles, blood exposure, or from a pregnant person to their baby during pregnancy, childbirth, or breastfeeding. Understanding transmission is not about creating fear, it is about recognizing risks so that informed choices can be made. Section 4. Symptoms or the lack of them. One of the most dangerous aspects of sexually transmitted infections is that many cause no symptoms, especially in the early stages. When symptoms do occur, they can vary greatly depending on the infection and the individual. Common symptoms may include itching, irritation, or burning in the genital area, pain, or burning during urination, unusual vaginal or penile discharge, sores, blisters, ulcers, or warts, pain during sexual activity, lower abdominal or pelvic pain, rashes on the body, hands or feet, flu-like symptoms such as fever, fatigue, or swollen lymph nodes. These symptoms may be mild and easy to ignore. In some cases, they may disappear on their own, leading individuals to believe the problem has resolved. However, the infection may still be present and causing internal damage. Because symptoms are unreliable indicators, routine testing is essential. Section 5. The consequences of untreated STIs. When sexually transmitted infections go untreated, they can lead to serious and sometimes irreversible health complications. In women and people with female reproductive systems, untreated STIs can cause pelvic inflammatory disease, which may lead to infertility, chronic pain, or ectopic pregnancy. In men and people with male reproductive systems, untreated infections can cause inflammation, pain, and fertility issues. Some infections, such as syphilis, can progress to affect the brain, nerves, eyes, heart, and other organs if left untreated. Untreated STIs can also increase the risk of acquiring or transmitting HIV. During pregnancy, untreated STIs may result in miscarriage, premature birth, low birth weight, or infection in newborns. These outcomes are often preventable with early detection and treatment. Section 6. STI testing and diagnosis. Testing for sexually transmitted infections is usually simple, fast, and confidential. Depending on the infection, testing may involve a urine sample, a blood test, a swab from the genitals, throat or rectum. A physical examination. Healthcare providers may recommend testing based on age, sexual activity, number of partners, or other risk factors, not just symptoms. Many clinics, including community health centers and sexual health clinics, offer low-cost or free testing. Results may be available the same day or within a few days. Regular testing is a key part of responsible sexual health, even for people who feel healthy. Section 7. Treatment options. What can and cannot be cured. The good news is that many sexually transmitted infections are treatable, and several are completely curable. Bacterial and parasitic STIs, such as chlamydia, gonorrhea, syphilis, and trichomoniasis, are typically treated with antibiotics or antiparasitic medications. When taken correctly, these treatments can cure the infection. Viral STIs, such as herpes, HIV, and hepatitis B, cannot be cured, but they can be effectively managed with medication. Treatment helps control symptoms, reduce complications, and lower the risk of transmission. Advancements in medical care mean that people living with chronic STIs can maintain long, healthy, and fulfilling lives. It is crucial to complete all prescribed treatment and attend follow-up appointments if recommended. Section 8. Reinfection and partner notification. A common misunderstanding is that once an STI is treated, it cannot return. In reality, reinfection is possible. If sexual partners are not tested and treated, the infection may be passed back and forth. This is why partner notification and treatment are essential. Many healthcare providers can assist with confidential partner notification services, ensuring privacy and safety. Avoiding sexual activity until treatment is complete helps prevent reinfection and transmission. Section 9. Prevention strategies. Preventing sexually transmitted infections is about reducing risk through informed choices. Effective prevention strategies include consistent and correct use of condoms and dental dams, regular STI testing, limiting the number of sexual partners, vaccination for HPV and hepatitis B, avoiding sexual contact during active symptoms or outbreaks, open communication with sexual partners. No prevention method is perfect, but combining strategies significantly lowers risk. Section 10. Communication and consent. Open communication about sexual health builds trust and safety. Talking about STI testing, protection, and boundaries may feel uncomfortable at first, but it is an essential part of healthy relationships. Consent means that all parties feel informed, respected, and empowered to make decisions about their bodies. Clear communication protects everyone involved. Section 11. Breaking the stigma. Stigma remains one of the greatest barriers to sexual health. Fear of judgment often prevents people from getting tested or treated. This silence allows infections to spread and causes unnecessary suffering. Sexually transmitted infections are medical conditions, not moral failures. Normalizing conversations about sexual health helps individuals and communities stay healthier. Conclusion. Taking control of your sexual health. Sexually transmitted infections are a reality, but they do not define a person's worth, character, or future. Knowledge empowers people to make informed choices. Testing provides clarity. Treatment offers relief and protection. Taking care of your sexual health is an act of self-respect and responsibility. The more openly we talk about STIs, the safer and healthier our communities become. Your health matters. Your choices matter. And informed decisions make all the difference.